a complete wellness t-shirt tonight, not just a ratty old t-shirt, because I walked home and it's about 1,000 degrees and 5,000% humidity out there.
It's hot.
But having said all of that, welcome everybody to our first, what is this called? Complete Wellness Forum. I'm a little out of practice. And this is our world of wellness, all things wellness that we're going to discuss. Primarily functional medicine, functional wellness, but all things wellness. We may delve off into other things. With me tonight is the lovely Diana Orchant, freshly back. That's why she looks all rested and tan.
It's true.
That we're hearing about more and more and more. I was just talking with the doctor today, and he told me that he sends 75% of his patients to be tested for this, and 85% of them come back positive.
Yep.
What is it I'm talking about? I'm talking about SIBO.
Which stands for small intestinal bacterial overgrowth.
Small intestine bacterial overgrowth. Okay, so let's dive in a little. We're always talking about the gut. What is the gut made up of?
So the gut is made up of the colon and then the small intestine and
wait, what's the colon?
It's the large intestine. The large intestine
colon
is
also called the large intestine.
Mm-hmm.
Okay.
And then we also have the small intestine.
And that's the gut.
Yeah, both of them. Yep, together.
And what's the microbiome?
Also the gut, but it's all the microbiome is all of the good and the bad bacteria that live inside the gut.
So inside both the small and the large intestine, we have bacteria. And what's the purpose of the bacteria? Why do we need that bacteria?
Oh my goodness, we need it for everything. We need it to fight disease. We need it for our immune system. We need it for digestion. We need it for our mood. We need it to create neurotransmitters to make us happy, to make us less anxious. We need it for literally daily function. We are more bacteria than we are human.
Wow. So we need all this bacteria. It sounds like, to me, the more the better.
The more, not always. That's where SIBO comes
in. We're Americans. More is better.
No, so what happens is we want a lot of good bacteria in the large intestine or the colon. That's where a lot of it lives. If anybody on this or anybody watching has done a GI map, that's what we're looking at. But where the problem lies is where some of that bacteria in the large intestine or in the colon sneaks up into the small intestine where it shouldn't be. So what happens is you start to get
one second.
Yeah.
Clarify that. We have different bacteria in the large intestine and the small intestine?
We have most of our bacteria lies in the large intestine. It should not seep up into the small intestine. When it does, that's where small intestinal bacterial overgrowth, SIBO, comes into play, because ideally it kind of stays in the colon, and it could be good or bad bacteria. And so sometimes we kind of can get a sense of this by looking at the colon's health and say like, wow, this person has so much bacteria. And you can get a sense that like it's likely kind of leaking into the small intestine where it shouldn't be.
So in the small intestine, we don't want bacteria,
We don't want that much of it. Nope.
just a little.
Maybe just a little, not too much.
How would it come to pass that the bacteria from the large intestine would seep into the small intestine? How does that happen?
So there's a lot of risk factors. One is PPIs or proton pump inhibitors. If you've ever taken like Zantac or pantoprazole, these medications, actually 50% of patients taking these medications in the long term for like at least well over 3 months had SIBO versus those who did not. The other risk factors are things that slow down motility. So think opiates, think narcotic use, think anything that's like blocking you up. It happens a lot. And like, I actually saw that a lot in the hospital setting. People on these kind of more intense drugs were not going to the bathroom. So what happens? It gets stuck there and moves its way on up. Slow motility in general can cause SIBO, and then just small intestinal disorders like Crohn's, celiac, diverticulitis. You're at a way higher risk of getting SIBO too.
Interesting. What are some of the symptoms that might come from SIBO? How would a person think that they might have it?
Yeah, it's hard because a lot of GI issues kind of look similar, but some of the signs and symptoms of SIBO are bloating, gas, especially discomfort kind of above the belly button area, right, where the small intestine is, above the colon. Frequent belching is a big one, acid reflux, diarrhea, constipation. Oftentimes people are diagnosed with IBS and told like, there's not much we can do. Unfortunately.
And all of that comes because a little bacteria seeped from the large intestine to the small intestine.
Yeah. And the worst part is the symptoms can become more systemic than just in the gut. So you start to notice iron deficiency, acne, rosacea. Some functional dermatologists are starting to test for SIBO now. You start to see B12 deficiency. You might even start to see like signs of malabsorption, weight loss, like unable to kind of absorb the foods you're eating.
Wow.
Yeah.
So how does a person find out if then they in fact do have it?
So there's a few different ways you can do testing. One is through an endoscopy, which is unlikely, right? Unless you're going in for something else. But what we would use is the glucose.
Would you go for an endoscopy to find out if you have it?
No, you can just do it while you're there. But the test that most practitioners are using now is a glucose hydrogen breath test. You drink a glucose solution, you eat a specific diet the day before, and you basically breathe into specific tubes. And they're able to measure your hydrogen gas versus your methane gas. Because there's two different types of SIBO, hydrogen and methane dominant, right? One of these gases is more dominant than the other. That's kind of how you get diagnosed.
Sounds very complicated. And that's because the bacteria gives off these gases while it's digesting stuff. And is that the
and there's specific bacteria that are more likely to be there, like groups of like there's bacteria called methanogens, right? And those are all methane dominant bacteria. And so if you would oftentimes too, you can see just based on your symptoms. If you have a lot of methanogens floating around, then you're likely to be more constipated.
A lot of what was that word?
Methanogens, like methane producing bacteria. But yes, so basically, long story short, it's based on these gases that these bacteria produce.
So this means that you're having terrible flatulence and belching?
Mm-hmm.
Both?
Often both, sometimes just one or the other, but yeah.
Is flatulence normal?
No, I mean, sorry, some yes, excessive amounts no.
Where do you draw the line between some and excessive?
You'll know.
Okay.
We're not going to make you count, but you'll know.
So at Complete Wellness, do we test for SIBO?
We do. Yeah.
We do. So if a person's having all these symptoms, they might want to come in and get tested.
Yes, absolutely.
Could you say the symptoms again slowly?
Bloating, gas, like very frequent gas, abdominal discomfort, frequent belching, acid reflux, diarrhea, constipation. Yeah, those are pretty much the main ones to look out for. Bloating a lot too. It can
Bloating
be
is
below the
one of
belly
the big
button.
ones, I think,
Bloating's
right?
a big one. Yeah, especially above the belly button.
When people feel like they're having a little meal baby.
Yeah, where you look pregnant.
And that's from the gas.
Yeah, absolutely. You're very distended from it.
How soon after a meal might you have that bloating?
It can be anywhere from right away to a few hours later. But a lot of patients are not waking up bloated. They're getting more and more bloated throughout the day.
I guess as the gas is produced.
And as you still could wake up bloated, don't get me wrong, from like the day before and everything, but also as you're eating. Yeah.
And this is, what's it called again?
What? Small intestinal bacterial overgrowth? SIBO?
Yeah.
Yeah.
SIBO. We're talking about something called SIBO, which is becoming rampant, almost epidemic.
Mm-hmm.
So why would a person get SIBO?
So you want me to go through the risk factors one more time?
Yeah, just let's continue to put the pieces together.
Okay, so using a lot of PPIs or acid blockers, meaning Zantac. PPIs is proton pump inhibitors. It's a class of drugs, right? So think like Zantac, think Prilosec, think pantoprazole, Nexium, exactly. These drugs that decrease our stomach acid. I was saying earlier, like over 50% of patients who take them long-term, you should not be taking them for more than 3 months. You should talk to your doctor about that if they tell you to. That's when these problems arise. Anything that slows down motility. So if you're more likely to be, constipated, you want to make sure things are moving through the gut efficiently. And so opiates, narcotic use, any medications that really block you up. If you're somebody who's like taking Imodium daily, hopefully you're not, that would obviously be a risk factor. If you're not very active, that can slow motility. And then just any small intestinal disorders can often cause SIBO as well. Diverticulitis, Crohn's, celiac, etc.
Obstructions.
Yeah.
Got it. Okay. So you have these symptoms. You're probably taking some stuff, not eating so well, not moving enough. You come, you get tested, you have it. Boom. Now what?
So there's a few different paths you can go, and it depends on how intense your SIBO is and how intense your symptoms are. And that's where you want to work with a functional provider to figure out what your best path is. There's no like you protocol that everybody does. Yeah, like me, like a doctor, like a functional doctor. Exactly. So the few options are, one is antibiotics, like the ones that are most known for SIBO, depending on the type, is rifaximin or neomycin. Sometimes they're used together. The thing about antibiotics, though, is you want to be careful because antibiotics alone work really well. And those two are very specific to the gut. But signs and symptoms often return really quickly if you don't do it right. And so the way to make sure you do it right is to make sure you're following a diet plan, working with a nutritionist like myself, as well as using ideally herbal therapy like antimicrobials along with the antibiotics. Other option is just using antimicrobial herbal therapy, which we decide based on your case, if that's a better option than going the antibiotic and herbal route.
So I'm assuming if it's the worst kind of case, you want to use both. And if it's more on the mild side, just the antimicrobials.
Exactly.
And so let's say a person has it. Let's follow this path a little. Or the person has these symptoms. They come and they get tested. They have a bad case.
Mhm.
So they do both the antibiotics and the antimicrobials. And their SIBO is, what's the word that I want to use? Remedied.
Yes.
Is that it? Their SIBO is over. They can now go back to their lives. What's next?
So it depends, right? Was there any downstream effects from the SIBO, which I've never seen a case where there's not. So you need to replete nutrient deficiencies that have come up because of it, right? B12 deficiency, often vitamin D is low, iron deficiency, just like malabsorption in general, right? So we need to heal the gut and make sure that we replete those nutrients. Something else you'll want to consider is if there's anything else going on in the gut. So why was there all that bacteria there in the first place? And so you need to make sure that you enhance motility if it was a motility issue and there was constipation. You need to make sure that you're not hopping back on these drugs that could have caused this in the first place, right? You have to make sure that none of this is happening in the first place. And then also, is there anything else going on in the gut? Are your symptoms completely gone just because your SIBO is? And potentially no, like potentially that's where we would do further gut testing, like the GI map test, to figure out what's actually going on in the colon alongside of the SIBO. But oftentimes treating the SIBO can treat some other issues in the gut as well. So sometimes we just hit two birds with one stone.
So my doctor, I'm making this up, my doctor told me I have H. pylori and I have to take Nexium or one of those purple pills forever.
There's so many things wrong with that. First of all, if you have H. pylori, the H. pylori is thriving because it's a non-acidic environment in the stomach where it should be. Oops, my battery was just like. So it's a non-acidic. H. pylori, that bacteria loves to thrive in a non-acidic, a very basic environment. So taking proton pump inhibitors to lower your acid or acid blockers in general,
it's going to make it worse.
It's going to make it worse, right? H.
Okay.
pylori is going to
flourish.
It
was a bad question.
No, but that's what happens. It's not a bad question. That's what happens. Because because H. pylori causes acid reflux. So what do? You block the acid. That's what happens in today's world. So what do we have to do? We have to give you something that's going to actually kill off the H. pylori. So we'll use an herbal protocol, a bit different from the SIBO protocol. And then we'll work on increasing your stomach acid so that doesn't happen again once the H. pylori is gone.
Got it. So H. pylori is bad to have.
Yes, it is. And oftentimes
it's abnormal.
Yes, but it's very common. But yes, ideally you don't want to have it because it can cause.
Why is it so common?
Because it's passed by like saliva. So oftentimes when you have it, your partner also has it, and then I create drama in the family.
This is getting complicated again.
No, I mean, I say like, does your husband also, or your wife, whoever your partner, also have like a lot of belching, acid reflux, etc.? And everyone's always like, yeah, why? I'm like, they should probably get treated too.
And does that speak to things like washing dishes well and not sharing glasses and
yeah. Makes you think twice before you just like share a bottle of water with anybody.
Okay, I'll keep that in mind.
But if your stomach acid is nice and high, H. pylori won't thrive. So the ideal situation is that you have good levels of stomach acid so that H. pylori enters your system and it's gone.
Got it. Any questions out there? Would anybody like to ask something about SIBO or H. pylori that we somehow got into? Diane, is there anything else you want to say about SIBO?
Just that if you are diagnosed with SIBO, you have to figure out, don't let anybody just tell you to go on a low FODMAP diet, which is oftentimes like the diet that goes along with it.
Hold on. What's a FODMAP?
So FODMAPs are different types of fiber. FODMAPs is like an all caps situation.
What does FODMAP stand for?
It stands for, it's fructooligosaccharides, oligosaccharides, disaccharides. I don't have them all memorized, but that's what the FODMAP stands for, all these different types of fibers in the diet. And so, here we go. Oligosaccharides, disaccharides, monosaccharides, and polyols. So these are all different types of fibers, which you're getting through tons of fruits and vegetables. So you don't necessarily want to just go on a low FODMAP diet out of the blue, mainly because you're limiting the fiber in the diet. It's extremely hard to follow. It's nothing about it is intuitive. And it's usually just a slight Band-Aid approach and doesn't actually get you better. So if you're on a low FODMAP diet, it shouldn't be for a long period of time, which is often prescribed for.
We have a question. Is SIBO related to leaky gut?
Yes, because leaky gut is really a term for just the intestinal barrier is compromised. So foods are leaking through, your immune system is weakened. But essentially when this leaky gut happens because you have a lot of different bacteria in the colon that are causing inflammation. And so if you do have a lot of this, it might trigger SIBO as well. They're not like directly correlated, but there's definitely a connection there. A lot of people with SIBO have leaky gut.
Leaky gut is in the small intestine or in the large intestine?
The large intestine.
Got it. Just a little pop quiz there. Anything else you want to say about SIBO, leaky gut, H. pylori?
Just that if you have symptoms,
say,
it's not normal. So get checked out and don't just accept like walking away with an antibiotic of some sort without figuring out like exactly what's happening in the gut. Because oftentimes it's more than one thing.
Do you recommend eliminating gluten? I just want to clarify the question, Patty. Do you recommend are you asking about eliminating gluten with SIBO or just generally?
That's a good question, Dr. Fenster, about that question.
Thank you. I mean, I just think, it needs to be clarified. But one of the things that I'm going to say, and hopefully Patty will answer my question, is we're seeing so many people with SIBO. We're seeing so many people with SIBO and don't know it and are not treating it properly. So if you're having any of these symptoms, particularly the bloating, please come in and get tested so that you can get the proper treatment regimen for your situation. Patty wants to know about eliminating gluten with SIBO and with leaky gut.
So oftentimes...
Good questions, Patty.
Yeah. So first I'll answer with SIBO. If it's a trigger for you, absolutely. SIBO, like glutinous grains are high in FODMAP, so it's likely a trigger. Once you clear the SIBO, you can test and see if you then react to it, right? In terms of leaky gut, absolutely, I recommend it. There's been studies that show that gluten actually triggers zonulin, which is this protein that sits on the gut lining that opens up the gut lining and actually causes leaky gut to happen. And so gluten is a trigger for that, for those who are susceptible. And yes, Hashimoto's absolutely, because gluten something called molecular mimicry occurs, where gluten, essentially the protein in gluten, looks similar to the thyroid gland tissue. And so what happens is if you eat gluten, your thyroid attacks itself even further. So we've seen that patients who cut out gluten, there's some other foods too, gluten's one of them now, actually their Hashimoto's antibodies, or their thyroglobulin antibodies, their TPO antibodies, actually go down. So those are quick answers to those three things.
You make a very important point, which is we're doing this podcast for a half an hour, and we're touching on some subjects and some interesting information. It's really difficult and obviously not personalized to give, answers about what's really going on with a person and what they should do. If possible, see a functional wellness, functional medicine practitioner, whether it's Diana or coming into our office, in person with diagnostic testing is the best. Diana does a lot of Zoom consultations with patients, and we can also, send people for testing if you're elsewhere. So this is just informational, obviously. And if you want real care, real answers, please come see us at Complete Wellness. So I think we're going to sign off for tonight. We'll see you all next week with another, thank you, Patty, with another great subject in the world of wellness, all things wellness. Thank you, Diana. Have a great week, everybody.
Thanks, everyone. Thanks, Dr.